Back now on Triad Today, and sometimes we set aside some time to talk about kids and taking care of kids because it's so important. And we have an expert in the field to do that, expert in pediatrics, with us right now. Cheryl Lauber, she's a licensed practical nurse and physician practice coordinator for Northern Pediatrics, part of the Northern Regional Hospital family. Good to see you, Cheryl.
Nice to see you.
What role do you play as an LPN as far as and physician practice coordinator for something like the Northern Pediatrics? What role do you play?
My main responsibility is I work in the lab, which means I give a lot of immunizations all day long. I run the tests for sick children, for COVID, for flu, for strep, for RSV, a lot of that.
You've been really busy on that the last few years.
We have been. Strep has been going crazy. And then
Strep
has lately been very bad with the kids at school. So we do a lot of testing. And then, of course, if the providers need something additional, an EKG, hemoglobin, nebulizer treatment for a child, that's my main responsibilities in the lab.
We didn't rehearse this or anything, but I'm just curious, maybe some of the folks at home, too, are about age range of people, kids you see. I've heard all sorts of different answers before over the years. I mean, I guess it's from infant or up to what age can you see?
Yep, from newborns up to 18
really?
Is what our practice sees.
So pediatrics can see up to 18,
yes.
age 18.
Mm-hmm.
Now, how do you collaborate, or do you collaborate with pediatricians in order to provide a comprehensive care for the kids? What kind of collaboration?
We are responsible for the nursing staff. We room the children, so we get all of their vitals and all of their, then we do their hearing screening and their vision screening and hemoglobin and lead testing and incorporate all of the questionnaires into the computer as necessary. If they're sick children, we run the test before the doctor gets there, so the doctor has information when they get in there as to how to appropriately treat the child.
And you have so much experience in treating physical things, but let's talk about mental conditions and behavioral things, because it seems like lately, and maybe it's because of the rise of the social media and internet or smartphones, I don't know, there's lots of answers to that, I guess, but how do you address mental health issues and screenings and stuff like that in kids these days?
There are questionnaires that we do hand out to parents that the children answer as well as they can, and with the parents' help, and then the providers meet with the children. If they need counseling, then we refer them to a counselor who's can do that better than, it's a specialty.
Right.
So monitor that as closely as we can. We do also diagnose for ADHD and ADD. Again, there's screening questions, and the parents get questionnaires, the teachers get questionnaires, then the providers meet with them. Do they need medication? Do they need counseling?
Yeah, we had a lot of debate about vaccinations during COVID, but then you sort of backtrack and say, well, we've had to do vaccinations with kids forever, going to school and before you can start public school, that kind of thing. But there's a lot of, ever since COVID, there seems to be a lot of misinformation in general about vaccinations. What do you do to help parents get educated about vaccinations so they don't get the wrong information?
All of our providers and all of the office is very an advocate for immunizations. So at every well visit, they get something, it's a VIS, it's vaccine information sheets that are very detailed as to what the vaccine is for, what are some of the possible side effects. Then the doctors will also go over that when they're meeting with the parents as to the necessities. There are recommendations by the state. There are requirements by the state also as to what vaccines should be administered.
And you guys can really keep the parents straight on that when they come in for that.
Yep.
That's so important because, like I said, there's so much misinformation about vaccines and all sorts of things going on the internet. Go to the source, and that's you guys. That's your team.
Yep.
That can do that.
We provide all the information. We have all of the vaccines in-house, so when they're recommended, the doctors and the staff will provide those vaccines as necessary.
That's just great. Up on screen, choosenorthern.org is a general hospital website, which I hope you'll check out, tell about all the different services of the hospital. But if you'd like to get in touch with Northern Pediatrics, that number's on screen as well, and that's 789-6267 in Mount Airy. And Cheryl, I just appreciate all you're doing for so many kids.
I appreciate being here. Thank you so much.
Thanks. We'll be right back.